Super quick before we begin, please subscribe, like this episode, and comment for the next community medicine topic you want. It takes seconds and really helps us grow. Thanks. Welcome to episode 3 of our case based scenarios series. Today we zoom in on diarrhea and dehydration, how to look and feel, classify, and choose plan A, B, or C exactly as per India's Integrated Management of Neonatal and Childhood Illness, spelled out as IMNCI, and the government's current campaign against childhood diarrhea. Dr. Joshi, welcome back.
Glad to be here. Remember two anchors. First, the IMNCI 2023 chart booklets for health workers and medical officers guide assessment, classification, and treatment. Second, the Ministry of Health and Family Welfare's Stop Diarrhea campaign, earlier called Intensified Diarrhea Control Fortnight, emphasizes the prevent, protect, treat strategy with low osmolarity ORS and zinc for 14 days. Keep these names and phrases ready for exams.
Scenario 1. A 2-year-old has 2 days of frequent loose stools. The child is irritable, thirsty, and the skin pinch returns slowly. How do we classify dehydration, and what is the fluid plan?
Use look and feel. For a child aged 2 months to 5 years, some dehydration is diagnosed if there are 2 or more of restless or irritable, drinks eagerly or is thirsty, sunken eyes, skin pinch goes back slowly. Here we have irritability, thirst, and a slow skin pinch. So classify some dehydration. That is yellow classification. Management is plan B. Give ORS 75 ml per kg over 4 hours, then reassess. If improved or no longer thirsty with normal skin pinch, shift to home care. If not improved or if signs worsen, reclassify. Alongside, start zinc for 14 days, 20 mg elemental zinc daily for children 6 months to 5 years, 10 mg daily if 2 to less than 6 months. Continue feeding and teach the mother how to prepare and give ORS frequently, including after each loose stool. Home advice would be continue normal diet, give extra fluids, watch for danger signs, drinking poorly, repeated vomiting, marked thirst, lethargy, blood in stool or fever, and return immediately if they appear. Schedule follow-up in 2 to 3 days or earlier if concerned. Pause and recall. Which single numeric you must remember for plan B? Answer: 75 ml per kg over 4 hours.
Scenario 2. A 3-year-old at the sub-center has watery stools every 2 to 3 hours. The child is restless with a dry mouth and sunken eyes. How should the health worker assess, classify, and what prevention advice do we give the mother to avoid recurrence?
Assessment again uses look and feel. Restless or irritable plus sunken eyes already gives 2 signs. If the child drinks eagerly when offered, that adds thirst. This is some dehydration. Manage with plan B at the sub-center, ORS 75 ml per kg in 4 hours, start zinc for 14 days, continue feeding, and reassess after the 4-hour period. If improved, shift to plan A home care with clear return advice. Prevention counseling for recurrence would constitute usage of safe drinking water, hand washing with soap at key times, hygienic food preparation, prompt ORS at the onset of diarrhea, safe disposal of child's feces, and keep an ORS zinc corner at outreach sessions. These are explicit objectives under India's Stop Diarrhea or IDCF materials. Pause and reflect. Which micronutrient for 14 days reduces episode duration and future risk? Answer: zinc.
Scenario 3. A 5-year-old girl with loose stools is lethargic, unconscious, and unable to drink. Please classify and describe immediate management at the PHC.
Lethargy or unconsciousness plus inability to drink meets severe dehydration. Red. This is plan C. Treat severe dehydration quickly. Start an IV line immediately and give Ringer's Lactate or normal saline if not available. 100 ml per kg total divided as 30 ml per kg, then 70 ml per kg. For children 12 months up to 5 years, give 30 ml per kg in 30 minutes, then 70 ml per kg over 2.5 hours. For infants under 12 months, it is 30 ml per kg in 1 hour, then 70 ml per kg in 5 hours. Reassess every 1 to 2 hours and keep giving ORS by mouth if the child can drink while the drip is set up. If IV access is not possible, start ORS via NG tube and arrange urgent referral. Consider intraosseous access if trained and equipped. Add the essentials, which are check for hypoglycemia, keep the child warm, monitor pulse, respirations and urine output, and document fluids accurately. Antibiotics are not routine. Consider only if you suspect cholera with severe dehydration or dysentery per clinical judgment. Once the child wakes and can drink, transition to plan B, then plan A with zinc for 14 days and feeding advice. These steps are aligned with IMNCI and the WHO hospital care guidance. Pause and recall. Which solution is preferred for plan C? Answer: Ringer's Lactate with normal saline as the alternative.
Scenario 4. A 6-month-old exclusively breastfed infant develops acute diarrhea. Why is zinc important here, and how do you counsel the mother about breastfeeding during the episode?
Zinc is critical because it shortens the duration, reduces stool volume, and lowers the chance of new episodes for the next few months. Dose for this infant is 10 mg elemental zinc once daily for 14 days. Counsel that zinc works even after diarrhea stops, so complete the full course. On breastfeeding, do not stop. Continue exclusive breastfeeding on demand and actually offer more frequent feeds. Breast milk provides fluids, nutrients, immunological protection, and is easily absorbed. Between feeds, if needed, give small sips of ORS. Teach the mother to watch for danger signs and to return if feeding difficulty, repeated vomiting, fever, or blood and stool occur. The IMNCI charts explicitly remind us that the normally frequent loose stools of a breastfed baby are not diarrhea. When true diarrhea occurs, continued breastfeeding remains a cornerstone of treatment.
Could you summarize the full classification ladder and plans for exam answers?
Sure, write it as a tidy staircase. Assess, look and feel. Level of consciousness, thirst of feeding, sunken eyes and skin pinch. Classify. First, no dehydration, green. Not enough signs. Then plan A, at home, extra fluids, continue feeding, zinc for 14 days if diarrhea present. Teach mother when to return. Second, some dehydration, yellow. Any 2 or more of irritable, drinks eagerly or thirsty, sunken eyes, slow skin pinch. Then plan B with ORS 75 ml per kg over 4 hours. Reassess, start zinc 14 days, feeding continued. Third, severe dehydration, red. Any 2 or more of lethargic or unconscious, not able to drink or drinking poorly, sunken eyes, very slow skin pinch. Then plan C, rapid IV rehydration with RLs 100 ml per kg, 30 ml per kg, then 70 ml per kg, timing by age, frequent reassessment, ORS if able, and referral if needed. Treat all diarrhea with zinc for 14 days and counsel on fluids and diet. This is a core message of the National Stop Diarrhea campaign.
Quick case-based drill before we close. 2-year-old, irritable, thirsty, slow skin pinch.
5-year-old, unconscious, cannot drink. 3-year-old, restless, sunken eyes, drinks eagerly. Answers you can recite. Some dehydration, plan B. Severe dehydration, plan C. Some dehydration, plan B. Add zinc to all and continue feeding.
Final take-home.
Keep it crisp, look and feel, then classify, then plan A, B or C with zinc for 14 days and strong caregiver counseling. Quote the IMNCI 2023 chart booklets and the Stop Diarrhea campaign in your exam answer to show currency with national guidance.
If this helped, please subscribe, like, and tell us which topic you want next. See you in the next episode.